Hello, my name is Natalie Halvorsen. I am an MD and PhD fellow at the Oslo University Hospital and the University of Oslo in Norway. I am here with my co-first author, MD and PhD fellow, Dr. Olaolu Olabintan from King's College London in the UK, to present our article, Environmental Impact of Computer-Aided Diagnosis in Colonoscopy, a carbon footprint assessment of a prospective cohort study. Before we dive in, a quick note on our last study, where we used patient-level data from the EndoBrain International trial and compared removal of all polyps submitted to histopathology with leave-in-situ optical diagnosis done by the endoscopist alone, with and without CADx. Both optical diagnosis strategies trimmed costs per colonoscopy across the US, UK, Japan, and Norway, roughly by $19 to $46 saved per case. There is only marginal differences between endoscopist alone and assisted by CADx, once the device cost was included. Notably, CADx mainly helped by raising high-confidence optical diagnosis from 74 to 93%, but the device cost blunted extra savings over endoscopist alone. Today's article asks a different question. What's the environmental impact of using CADx in colonoscopy when we apply a leave-in-situ strategy? We paired life cycle assessments using CIMAPRO with real patient-level outcomes to tally the CO2 equivalents from 4 components that CADx meaningfully affects: snares, polyp traps, histopathology, and the CADx unit itself. Dr. Ola will now share the results of our study.
Thank you very much, Natalie. Whilst the use of CADx slightly reduces consumables and histopathological submission, the CADx device itself adds its own emission. The total carbon footprint increased from 832 kg without the use of CADx to 946 kg with the use of CADx from our study, an absolute increase of 114 kg, which is approximately 0.1 kg per colonoscopy. Importantly, power management and longevity matters. The CADx contribution is around 0.31 kg per procedure in a standby mode, but this drops to 0.23 kg if the unit is unplugged out of hours. Also, the longer lifetime of the CADx itself further reduces the development and manufacturing emission costs. To summarize, from our study, under the leave-in-situ strategy, CADx increases carbon footprint modestly. However, power management choices, longer service life, and also pathway choices such as discard light can narrow this gap and should be weighed alongside clinical and economic outcome. We hope that the results of our study will be used in implementation of environmentally sustainable choices in clinical setting, and also be included in the microsimulation model, which will evaluate the total effect of AI in health, cost, and sustainability. Thank you very much.